All right, I just had a woman come into my clinic who passed out, fell, hit her head against the wall like this, and was unconscious. And they found her like this with her head pinned up against the wall. She's okay. They did a scan of her brain, and her brain was fine. There was no seizure. There was nothing like that. But now she has dizziness and ear fullness. Okay, so dizziness, ear fullness, you're thinking Meniere's disease. Okay, so they went to an ENT from the ear fullness, and they punctured her eardrum, and no change. Also, they did a hearing test, and hearing is fine on both sides. Okay, so ear fullness is usually coming from the middle ear, and the fact that they punctured the eardrum and there was no fullness, or there was no change in fullness sensation, means you can kind of rule out the middle ear. Also, if the middle ear was a problem, it would affect hearing. So we have hearing is fine, middle ear puncture didn't do anything, but there's a sense of fullness. And so this is kind of an interesting thing, is the sense of fullness is not coming from the middle ear. It's actually coming from one of these cranial nerves, right? So we palpated the side and along the neck, and usually if the eustachian tube is an issue, there'll be tenderness along here. There wasn't. Kind of ruling out eustachian tube. Palpated the side of the neck, a little bit posterior of the SCM along here, and now you get into kind of the auricular nerve and some of the facial nerves. Very tender and asymmetrically tender, more tender on this side. Okay, so that's a positive. Also palpated the base of her neck. We palpated the sides, and her atlas was level. But when we palpated the back of her head, we were getting radicular sensations into the front, and she starts to feel lightheaded. So these upper cranial nerves will create a sensation of vertigo, but it's more a sensation of lightheadedness. And also it is kind of comes and goes. So it doesn't last very long. It's more what I associate with like stress-induced vertigo, and not the Meniere's, which just comes as like strong spinning. So even though she kind of presented as Meniere's with the ear fullness and the vertigo, once we started talking and we realized that it was more of a lightheadedness sensation, and that her ear fullness wasn't coming from, was more of a nerve related. It also makes a lot of sense because it started with a neck trauma. So you can kind of just assume that the neck is going to be the problem. Anyways, hope that helps someone. It's an interesting story. It's nice to kind of share people's stories so that we don't feel so alone. But